60-year-old Mr. M&M complains that whenever he sweats, it leaves white-colored crystals on his forehead and face. What if I tell you that Mr. M&M suffers from multiple myeloma, and these crystals are in fact uremic frost, which is because his kidneys have failed to excrete urea from his body. To elaborate further on this, today I, Shreyasi Seth, am here to talk about kidneys in multiple myeloma. To start with, let us have a look inside one of Mr. M&M's bone. The red bone marrow is responsible for production of hematopoietic stem cells, which further give rise to plasma cells which produce antibodies. Now in this case, the plasma cells have increased to more than 10% and also they are abnormal. Abnormal plasma cells will obviously produce abnormal antibodies. Now, the antibody contains a heavy chain and a light chain. Since all the fragments of the antibody are not used up in making the normal antibodies, light chains get collected and they are found in the urine by the name of Benz-Jones protein. To know how this happens further, we can see that this is a filtering unit of the kidney called nephron. Suppose this is the filtering unit. Now you can see that normally bigger structures like this normal antibody cannot pass through the filtering unit. However, these light chains can easily be filtered through the glomerulus and get clogged inside the collecting duct, causing injury to the kidney. Further, in Mr. M&M, there is also increased osteoclastic activity. So this means that the bone is prone to breakage, that is osteolytic lesions. This will release calcium from the bones which will get deposited inside the kidneys. So there will be further damage. Moreover, abnormal antibodies are not as efficient in preventing infections. So there will be recurrent UTI, further causing damage to the kidneys called pyelonephritis. Moreover, Mr. M&M had been taking medications for bone pain since so many months. These medications, especially naproxen and other NSAIDs, cause damage to the kidneys. This condition, AKI, is seen in more than half of the patients of multiple myeloma. So what can be done? Number 1. Due to hypercalcemia in such patients, there is dehydration. Hence, we can ask the patient to increase the water intake. Moreover, we can do dialysis in such patients, medications, chemotherapy, and instead of other NSAIDs, we can prefer paracetamol and other opioids. This concludes the topic of kidneys in multiple myeloma.